Hello everyone, and welcome to the webinar, Motivation and Capacity, Factors that Influence Organizational Readiness. And now let's go ahead with some introductions.
Julie Breedlove is the Senior Communities and Priorities Manager for the Center for States. Joan Nelson Phillips is a Senior Associate for the Center for the Support of Families. And Mona Davis is the Region 6 Liaison for the Center for States.
With more than 20 years of public child welfare experience, Julie Breedlove's work has focused on workforce development, implementation science principles, and systematic problem-solving approaches at the state and national levels. With more than 30 years of experience in working with child welfare state systems, Joan Nelson Phillips is a CQI and practice improvement expert consultant. With more than 30 years of experience in child welfare at the local, state, and national levels, Mona Davis's work has been concentrated in the area of family engagement, resource parent recruitment and training, various program development, strategic planning, federal reporting, implementation design, and change management support and capacity building. I will now turn it over to our facilitator for today, Nicole Barnes.
Thanks, Chris. I'd like to take a minute to review our agenda today. I'm just going to go over this quickly. We're going to do a quick review of our objectives and then a high-level overview of readiness for the change and implementation process. We'll discuss a little bit about why organizations should take the time to assess readiness and go through the factors that influence readiness. We'll talk about how to develop an assessment approach and strategies to conduct an assessment, as well as analyze the results, and then we'll go through some common missteps and identify strategies to prevent them. At that point, we'll turn into our breakout sessions where you'll have an opportunity to discuss more one-on-one with your peers around how to approach readiness in your jurisdiction. Our objectives today, we do want you to be able to identify the process to understand readiness for change and implementation and identify those factors that contribute to it, as well as some tools that might be able to help you assess organizational readiness. Again, we'll talk about those strategies to assess and analyze readiness for change and implementation, and then offer you that opportunity to connect with your peers. So motivation and capacity, factors that contribute to organizational readiness. On this slide, you can see our change and implementation process visual.
The Readiness for Change and Implementation diagram shows a ring of concentric circles. The green outer circle is labeled Readiness. The blue inner circle has 6 lines extending from the outer edge to 6 different phase labels. The phases, clockwise from the right, are problem exploration, theory of change, intervention selection and design/adaptation, implementation planning and capacity building, intervention testing, piloting, and staging, and monitoring, evaluating, and applying findings. The next inner circle is orange and is labeled teaming, and the innermost white circle is labeled effective implementation.
And many of you may have seen this prior to today's event if you've been following this series. Overall, the series has 6 major buckets of topics. We have completed the first 4 of these briefs in the series. We have the overview brief available, problem exploration, theory of change, and teaming, all available on our change and implementation website. And starting this week, of course, readiness. So today we are talking about assessing readiness for the change and implementation process. As you can see in the graphic, readiness really wraps around the entire process. While it is particularly important to consider it before implementation begins, readiness is really kind of an ongoing and dynamic thing, and it's important to assess readiness throughout a change initiative. That can really help you to plan to put out key supports during each phase of the process. The readiness brief discusses the factors that contribute to readiness, as well as what we call our 3 essential functions or steps in assessing readiness, which are to consider the factors that contribute to readiness, develop an assessment approach, and then to conduct and analyze the findings. We're going to spend some time today looking at the reasons to comprehensively assess readiness, and then we'll look at each of these three steps in greater detail. And then we're also going to hear from Julie, Joan, and Mona that were introduced, who are our experts that do this kind of work in the field, on how this information can support jurisdictions in developing an approach, conducting an assessment, and analyzing results to meet their needs. So we're going to do a quick poll. We'd like to hear about your experiences with assessing readiness for change initiatives. So in the first question there, you can answer yes or no, or you don't have to vote. Has your agency used a structured process like this before to plan and conduct readiness assessments? So it looks like about 50-50 so far. Some have, some have not. So the second question there is if so, were you successful? So tell us about that. So I see that we have got someone that says you're currently in the process, so the success is yet to be measured. That's fairly common, we understand. The project is in process, but it seems to be going well. That's good. And feel free to share any challenges that you may have as well in the process, in the chat room or in the participant chat. So mixed results in the past, that's not uncommon either. So yes, we've seen it done repeatedly and had varying degrees of success. Okay, great. We've used a community readiness process to assess readiness for substance abuse services. Okay, great. That's a good step. Okay. Well, let's go ahead and move back to our slide deck. Thanks for taking the time to fill out the poll there. So let's take a minute to reflect on our experiences with readiness. You guys answered some of the successes you've had, but I want to ask a couple of questions just to get us thinking. You don't have to respond to these, but if you'd like to, please feel free to do so in the participant chat. So I wanted to ask if you can think of a time when your agency was involved in an initiative that was aimed at improving outcomes that you believed would be successful, but then did not see the desired outcomes. And really think about what impact you think a more comprehensive understanding of readiness might have made on the success of the program. Again, you don't have to respond, but I just wanted to get us thinking about readiness. We know that understanding the role that organizational and intervention-specific readiness plays in this cycle really is critical to see long-term sustained improvements in our desired outcomes. When you can see where your agency is prepared and where there are gaps that will need to be addressed before moving forward to implementation, it does increase the likelihood of a successful implementation. So why do implementation teams assess readiness? Well, the research tells us that when organizations understand the components of readiness and can really efficiently assess the factors that influence it, that this actually contributes to being more ready. We know that assessing readiness helps to identify gaps and where agencies might need support. It also helps to prepare team members and the organization as a whole for change initiatives. It also sets the foundation for new interventions as well as a benchmark for ongoing readiness monitoring. When organizational readiness is high, our change efforts are more likely to achieve successful implementation. So let's talk a little bit about defining readiness. There are a couple of different types of readiness. Readiness for implementation really is the extent that an organization is willing and able to put in place and sustain a selected intervention, while readiness for change is the extent to which an organization is willing and able to pursue efforts directed at improving outcomes. To assess both types of readiness, organizations really need to go through an assessment process. It's not as simple as just asking if we're ready or not, right? So teams can use an equation. As you can see, the equation there on the screen is R equals MC squared, or said another way, readiness equals 1 part motivation and 2 parts capacity. So motivation is that willingness or desire to change and to adopt an intervention. And it's often reflected in the beliefs, attitudes, and the commitment of those that are involved with the change effort. The second piece of that equation is general or foundational capacity. And these are the aspects of an organization's functioning, like infrastructure, resources, or knowledge and skills. For example, an agency that has strong general capacity, they might have strong leadership, have enough qualified staff, and clear expectations and procedures for how things are done. The agency must also be adaptable and have structures in place that support a change process, like their data systems to monitor and training systems to build new skills. The last piece of that equation there is intervention-specific capacity. And these are the conditions needed to effectively implement a specific program or practice. These are things like knowledge of the intervention, the skills to implement it, as well as the structures and supports that are needed. So why should organizations consider the factors that influence our motivation for readiness? For agencies, for change to take hold, agency leaders, managers, workers, as well as all of the other stakeholders involved really have to value that change. They have to be willing to do what it takes to make it happen. An organization can have a lot of resources and a lot of capacity, but the reality is if they lack the desire and an incentive to achieve that change, then any intervention is really going to struggle to be realized. So let's take a look at what are the factors that influence motivation for readiness. The first one there is compatibility. And this is just believing that the intervention is the right fit with the team's values, beliefs, their experiences, and needs. The second piece is manageability. It's understanding the intervention as a whole and really believing that it is doable from both the supervisor as well as our frontline staff perspective. Prioritization. So is change in general prioritized in the organization? And is the selected intervention specifically a priority for the agency as a whole? So when innovation like this is expected and becomes a normal part of our cycles, then motivation to implement these types of things becomes stronger. Relative advantage. So is the proposed change perceived to be better than the choices, than the alternative, or what we're currently doing? When teams can see the advantage of an initiative, then their motivation to achieve it really increases. Visibility of outcomes. So can our stakeholders see the potential positive outcomes with this particular change initiative? Are there some indicators or some data or evidence from other implementations to suggest that the intervention could be successful? All of these types of evidence will help to support buy-in for a new change effort or intervention. So let's walk through an example. For agencies really can communicate about why a new program or a practice is necessary, which would be prioritization. They can offer training materials that break an intervention into easy-to-follow steps, which make it more manageable. They can embed interventions into existing structures or practices, which is the compatibility. And then they could share data and initial successes to build buy-in and encourage motivation, which aligns with that visibility of outcomes. So understanding where that organization stands and the factors that influence motivation can really help leaders and managers be more willing to take even manageable risks on new approaches or new ideas and to develop the supports that increase motivation to achieve it. So let's move on to factors of general capacity. As we talked about in that equation, there are two types of capacity. That's general capacity and intervention-specific capacity. General capacity reflects an organization's ability to adapt and achieve its goals. And this type of capacity will impact an agency's readiness to implement any program, practice, or change. So let's look at the factors that influence general capacity. So leadership. Does leadership at all levels of the organization really foster change through attention as well as allocation of resources to all of the change initiatives? Does leadership have the technical and adaptive skills to address challenges? How about organizational innovativeness and receptivity to change? Does leadership and the organization as a whole encourage innovation? As we talked about, that influences motivation as well. Do they encourage risk-taking and learning? Are staff receptive to trying new things to solve problems? When we have openness to change and innovation, it increases a team's general capacity. So culture and climate are often grouped together, but they're very different. So as far as culture is concerned, does culture of the organization, including the behaviors, the beliefs, and does it support future change initiatives? We know that when we have knowledgeable and skilled staff that really are engaged in decision-making and have some discretion on how to do their work, that change efforts tend to be more successful in their implementation. And then climate. Does the work environment encourage staff well-being and morale? Climates that engage staff in meaningful work, from the support of management as well as their peers, then they tend to be more accepting of a change effort. How about resources? Resource availability and effective use. So are there resources, including staff as well as funding, space, equipment that are available? Are they used effectively? And can the agency allocate and leverage these resources to implement and sustain the change? The next piece of that is support structure. Does the agency have support structures in place for decision-making ability, data use and collection? Do they have support structures for all of their CQI processes, as well as hiring, training, and coaching? And then partnerships or networking. Are there supports involved in that, as well as internal and external communication? And then the last piece that influences general capacity is staff capacity. So are there supports in place to increase staff skills and expertise on understanding and applying generally change and implementation concepts? The research tells us that the more our staff understand this process, that the greater buy-in they will have to achieve the implementation that the agency is trying to make. Let's move on to factors of intervention-specific capacity. This is the second type of capacity in our equation, and it relates to the ability to implement a specific practice or a program of interest. We know that agencies' needs for implementation are going to differ depending on different types of intervention. For example, an intervention that improves child well-being outcomes might require some knowledge on the physical and mental health needs of children in child welfare. It might include some trauma-informed practice skills, as well as close partnerships with community service providers. What about an intervention to improve child safety outcomes? That might actually require knowledge of risk and protective factors, probably some case decision-making skills, and also really close partnerships with the courts. So let's review the factors that influence intervention-specific capacity. We have, of course, leadership and buy-in, and do our leaders and managers support a culture and climate for implementation? And do they communicate the vision and the values of those changes and help to connect the new practices and programs to existing goals for all of the staff? Are there some program champions that are visible stakeholders? They usually work best if they have knowledge of the intervention, and oftentimes they need to be able to gain support for moving an intervention forward towards implementation, as well as being able to sustain it over time. So intervention-specific knowledge, skills, and abilities. Do they have the right staff with the right skills to do the work of the intervention? And then implementation support. Does the organization have the foundational supports like leadership, competencies in the areas needed, and organizational structure to actually implement and sustain the change? And then the last piece there that really influences intervention-specific capacity is relationship and networks. So are there interagency and partner relationships to provide ongoing collaboration? Are there other peers or system partners that have implemented similar changes that they can reach out and learn from? So I want to pause here, and we're going to take a minute to hear from our expert panelists. So I'm going to turn it over to Julie to guide our conversation with this first question. So Julie and Mona and Joan, if you'd unmute your lines. And I want to start off by asking, what in your experience have been some of the benefits when jurisdictions take the time to do this work in readiness?
Thanks, Nicole. Yeah, I've actually seen improved implementation evidenced by stronger engagement and involvement of leadership and staff in the initiative all along the way with full region-wide implementation of the initiative. I think that's the benefit I've observed when a statewide jurisdiction seriously assesses and considers regional issues such as stability of leadership and buy-in, caseload sizes and supervisory ratios, investigation backlogs, unassigned cases or cases carried by supervisors, and the strength of relationships between the region and courts, also with service providers, with law enforcement, school system, foster parents, and advocates, and the climate and tone of the work culture and office conditions. I think another experience that I've had is having honest and transparent discussions about these issues, resulting in decisions being made whether to move forward with regions that seem to be prepared or more prepared to move forward, and then also really considering delaying implementation with regions that still need to build their capacity in the above areas. Mona or Joan, do you have anything you want to add?
I mean, this is Joan. I don't. It's not so much to add. I guess it's just almost the reverse. It's kind of what you talked about, Julie. It's just kind of the pitfall is, and I think the lesson learned from the example that you shared is just for sometimes when we feel like we have to go forward no matter what. And so I think the example you provided speaks to the benefits of really taking the time to make sure that folks are really ready. And that's the benefit sometimes when you're looking kind of at regional, geographical capacity and readiness, and then trying to make decisions in a thoughtful way about moving forward at that time.
I agree, Joan. Mona, did you have anything you wanted to add?
Nothing to add to that, no. I think I've had that same experience, so I totally agree.
Okay, great. I wanted to ask you both, Joan and Mona, how much time does assessing readiness take? Is there like a common range? Are there important trade-offs to consider between time, scope, and assessment quality?
Hi, Julie. This is Mona. Thanks. I'll take the first stab at that, and then if Joan has anything to add. There are no really set amount of time to conducting a readiness assessment. It really depends on the many factors that have already been discussed in regards to where the agency is in the change and implementation process. It's dependent upon the complexity of the identified problems, whether the that the agency is seeking to address or change, and whether the agency really how committed the agency is in taking on the assessment effort and including this commitment of agency staff to participate, as well as access or even develop the necessary resources to move it forward, such as the data support. I think once the team has a consensus on some of these considerations, which also would include deciding it's on a readiness tool so that you have some intentionality and structure with that, as well as the approach, because there may be some pre-assessment work that's needed, which also will take time. The team will need to actually be deliberate about those readiness activities and implement them. And some of those things to consider, that can make the process really work more efficiently throughout readiness assessment and preparing for implementation is really around making sure there's clarity on the data collection approach and including who the designated leads are for collecting and disseminating data to the team members for analysis. Being thorough with the data collection process, which includes maybe perhaps conducting focus groups, disseminating surveys, being really thoughtful, intentional about the design of the questions. What does your data tell you, or what more do you need to know? This really helps lessen the likelihood you'll need to go back and collect additional data down the road. Sometimes we miss something, but if you're intentional about considering it right up front, that's always a good thing. Promoting a sense of teamwork and collaboration in collecting and aggregating this data, being open to different opinions and interpretations of the data while being focused on ultimately coming to a consensus. Really not trying to fix it right then, but really being intentional about what does it mean to everyone that's participating. And then setting clear start and end dates for the assessment process is really important, which is going to ultimately lead really to some of how much time your jurisdiction or how much time it is needed to really prepare for implementation and getting everything ready. Even if you have to make extensions along the way for completing certain tasks, it does help keep the process moving forward if you have a sense of structure in place. And to be honest, my experience has been that sometimes the data collection process are really the most time-consuming in the readiness as you're getting ready, as well as making sure you're well organized and that again, everyone is really committed to the work from leadership to staff. So overall, my experience, there's really not any set time frame, although your team may want to set those time frames, and they will be setting those time frames around the pre-work and the actual readiness activities and getting ready to do those next steps around tracking progress and really communicating and pacing that work, and just really being diligent and committed as you begin to execute everything. So I don't know if Joan has anything else to add, or even Julie if you do, but that, there's just so many things that have to be considered in regards to that, and it really is dependent upon where your organization is at with each of those considerations.
Yeah, I agree. I mean, this is Joan, and I could echo pretty much everything that you've laid out there, Mona. So I just think it really is dependent on your agency. And I know one of the things that's hard is that if there is a time pressure from agency leadership, or if you're just really under the gun and you got to go, it's a lot of pressure to try to do this work right, and you kind of pick your battles on some of this stuff. But the data collection part to me is just so key, because if you don't ask the right questions when you're going in to figure out what missing information you have, you really want to make sure that you're taking the time on that and keeping tabs on people, not just assigning it to some side committee to kind of do all the legwork on it, but really staying together as a team and talking to each other. So I think open communication during the data collection process and then being able to process that information together and come to consensus is also really key. If you're working together, that's what's going to make your process kind of move together and move forward more efficiently.
Yeah, I agree, Joan, and I see Sarah has asked a question in the chat box that I'm going to give an example of, and I think we'll have time to hear additional questions and be able to talk a little more when we break out into our breakout sessions. But Sarah's asking, I'm really curious to hear from others about how this work is structured within a state agency. Who does this work? Is it a team? Is it an individual? And Sarah, in my experience, that varies. I know in states that I've worked in, we really approached it from a team perspective. We had our mid-level managers at the state office really involved and were leads in the process, with a variety of folks participating in the project, in the assessment process. Making sure we had, representation from training, from information systems, from policy, from programs. And then also, we often strive to have voice from the field, and I think it's important to have family and youth voice whenever possible. And so, Nicole, I believe I'm turning it over to you.
Yeah, thanks, Julie. That was great. Thank you all for that great conversation. I hope that was really helpful for our participants today to start getting them thinking about planning for readiness. So we're going to move on and try to get through the rest of our presentation today. I wanted to take a moment, as Mona and Joan and Julie were talking about, it really is important to invest the time in a structured method. Not only to complete an assessment, but to consider how to approach the assessment. As we talked earlier, readiness wraps around all of the change and implementation steps in the process, but it can also have an impact on a lot of other tasks or priorities within an agency. So when we're preparing for, conducting, or analyzing the findings of an assessment, it's important to keep some considerations in mind. So we know that findings from ongoing readiness assessments can be incorporated into regular monitoring and reporting for our APSRs, for the semi-annual PIP reporting that we do, as well as other reporting and monitoring like consent decrees or settlement agreements or agency strategic plans. And then assessing readiness for organizational or foundational capacity really should be completed prior to the development of any large-scale or long-term improvement plan, as well as strategic planning cycles and an agency's CFSP. So next slide. It's always important to take the time to determine the scope of the assessment. So some questions to answer as a team as you're thinking about the scope is how comprehensively you intend to assess readiness and what is feasible. It helps to be as comprehensive as possible within the capacity of the team and the agency. And then thinking about the readiness domains that are of greatest interest or importance. So what questions about readiness are really of the highest priority to learn about? Thinking about the purpose of the assessment. Is it for a specific intervention that's already been selected that we need to identify some more targeted areas? Or is it intended to be an ongoing assessment of general capacity? And then looking at what tools are readily available. Is there a targeted tool that will help assess the areas of interest? Or for an ongoing general assessment, is there a tool that's already been used in the past that you may want to measure your progress against? It helps to use existing tools and then modifying them as necessary to gather the relevant information. So there's no single proven instrument, yet anyway, available to measure readiness for implementation in child welfare that applies across the board to all situations. But there are benefits to choosing a tool that's relevant to the type of assessment your agency needs and considering the reliability and the validity of the tool selected. So tools that measure a wide variety of factors can help identify strengths and weaknesses in overall capacity. And tools that focus on just a few factors might really help to explore areas more in depth. In the readiness brief that has just been released this week, there is an appendix that offers links to a number of tools that are available that agencies can take a look at. Questions may also need to be tailored to fit their requirements of a specific intervention. And so when you need to adapt those questions, it's important to think about these three areas: relevance, clarity, and specificity. Relevance is, are the questions in the tool meaningful? Clarity is, are the instructions clear? And then specificity is whether or not those questions are too general or too specific for your specific needs. There are also some factors to consider in selecting a readiness tool and how to conduct the assessments, including the scope, time to invest, and the purpose. Like we said, is it a broad tool with many factors or more specific and targeted? Is it designed to be able to share an understanding of overall readiness or to assess capacity for a long-term change or for a specific intervention? Do you have flexibility in your time frame to collect that additional information that Mona was talking about if the assessment reveals that a lot of the items are unknown or not ready? The measurement of the tool is something to consider as well. As a reminder, readiness is rarely a ready or not ready scenario, and the scale that you choose on the tool should include enough options to be able to consistently reassess and monitor changes over time. And then the type of responses are another consideration. So some tools really are intended to be completed individually and then to look at the total aggregate response. And others really are better for a facilitated discussion with a team to gain consensus on where the agency sits on any one of the items on that tool. So as part of the assessment process, teams will need to decide also who they want to collect information from. So they should consider these key groups, obviously a representative cross-sample from the organization, including your leadership, administrators, managers, supervisors, and other workers from different program and functional areas. The key stakeholders, like our court partners and other system partners, as well as family and youth representatives. And then also partner representatives like our community service providers. When we have a really broad representation of different audiences and then getting enough responses to gain a representative sample, that allows our assessment to be more comprehensive. So we're going to turn to our panel once again. And I wanted to open this up to Joan to lead with the starting question of what effective strategies have you seen to engage a diverse set of stakeholders in assessing readiness?
Yeah. Okay, well, thanks, Nicole. And yeah, I mean, I think we can all recognize and agree about how important it is and rewarding it can actually be when we take the time to engage stakeholders really in any of the work that we do in child welfare. So where I've seen agencies and states, I think, be more successful in this area is where there's been clarity and consensus, first of all, as to where in the change and implementation effort the agency is actually at. For instance, if you're at the beginning where the change is just being considered, or if you're further down the road and you're trying to assess whether you're ready to implement a specific intervention. And this is important because it informs the scope and the type of the readiness assessment that you're going to be conducting. And of course, that's important because it informs who you're going to actually need to participate in the process. And in my experience, I think what can be most helpful for agencies in being able to, pull a diverse group of stakeholders together is to just be really thoughtful and intentional early on and throughout the readiness process, basically having a plan about how you're going to bring these people together and taking the time to really consider some key factors. And I'm just going to kind of rattle these off, referring kind of to the who, the why, when, what, and how. And I'll just spend just a minute or two talking about each of these. But the who is kind of the obvious, like who are the stakeholders, who are the groups that you need to seek representation from, who do you need to engage, and so internal and external to your agency. Some of the groups that Nicole was just talking about, internal to your agency, thinking about staff, at different levels in your agency, cutting across different program areas, different geographical areas of your agency or your state. External to your agency, making sure that key groups' voices are heard, primarily like youth, parents, caregivers, foster adoptive parents, courts, tribes, some of those provider groups that Nicole was referencing. Then kind of thinking about the why, and why are you seeking to engage them specifically? What are the objectives in bringing any of these individuals or group voices to the process? The when refers to at what point or stage in the readiness process you're seeking to bring these stakeholders in. At the beginning, when you're seeking to kind of first consider some type of change for your agency, or later on when you're looking at implementing a specific intervention. I think the most important factor is really the what. What specifically are your expectations for their involvement? What role do you want them to play? What do you hope they're going to play? What specifically do you expect them to do? And being able to communicate that to them. So are you, going to ask them to serve on the actual team that's conducting the readiness assessment? Or rather, are you expecting or hoping that they're going to be ready to at least, participate in a survey or focus group? Or, sometimes it might be more a matter later on down the line, helping bring them into the process and having them help determine next steps and provide recommendations to leadership. So just thinking that through and being very transparent about what your expectations are, and being really clear in communicating that to stakeholders when you're actually inviting them into the process is key. And then equally important, I think, and what leads to success for agencies is the how. And how are you going to provide support to stakeholders so that they can fully participate in the readiness process in a way that they're going to find meaningful? It's going to want them to come back again and help you another time and contribute to the overall success of your change initiative. Thinking about how you put, caseworkers in a room with high-level leadership or youth at the same table as court, and having people be comfortable about sharing opinions and, providing ideas about what to do next. So just, providing an atmosphere, the support piece is key. So just, just a couple of other points I would just make in answering this question, Nicole, would just be being brave sometimes when it comes to the who. This is something I think about a lot that we could do better, thinking outside the traditional box when it comes to inviting stakeholders, internal as external as well, when you ask them to come in, not always going to what we would maybe refer to as the usual suspects, the same one or two supervisors or the go-tos, because they always are there and they're great. But sometimes making room for other voices is important. Not only having that one lone foster parent that seems to serve on every committee, the same one or two community providers. When you do this, you're actually making room for new perspectives and ideas, and you're expanding your own capacity, I think, for a broader and more diverse group of stakeholders that you can potentially tap into later on down the road when you need to have people helping you with your CFSP or your PIP or your CQI process. Just a couple of really quick points I would also make along these lines would just be being diligent and committed in terms of that who, and recognizing up front that it can be challenging in recruiting some stakeholder groups more than others to participate. You may need to be more flexible, for instance, when you're scheduling meetings or just in using different meeting platforms to accommodate important voices such as that of youth or families or caregivers. And even though it's harder sometimes to do this kind of work up front, I think we all know that it's worth it in the end. And finally, just reassessing stakeholder participation over time, not treating it as a one-time event, some type of a thing that needs to be checked off the list of things to do. We can say that we have stakeholders involved, but really being thoughtful about it. That's why, we've tried to kind of include this as a thread, I think, in today's conversation. So, who do you need at this particular stage in the process right now, and always reassessing that. If we've lost somebody, if somebody's not really fully participating because they can't, or maybe they don't even want to be there, going back and looking at that and making sure that you're creating those opportunities to bring other people in. So those were just kind of my preliminary thoughts on it. I don't know if Julie or Mona have anything that they'd like to add.
I think you did a thorough job, Joan.
Ditto for me, because those are some great points, especially about being brave and being diligent and making sure that you're assessing that stakeholder feedback throughout the process. So great.
Yeah. Okay, great. Yeah, that's something I've really thought about in my career, just ways to do that kind of stuff better. I just think it's so important. So I've got another question I'm going to put out there, and Julie's agreed to kind of be the first to respond to it. And that is, how can agencies plan and prepare for a wide variety of responses on readiness when diverse stakeholders are involved?
Yeah, Jen, and I think when it comes to recruiting stakeholders to participate on the actual team, you should really think about having a diverse mix of stakeholders to really have diverse voices, to have diverse thoughts and ideas at the table to be able to participate. Be open and welcome to a wide set of opinions and ideas throughout the readiness process. And you mentioned in your previous answer about being brave and vulnerable around that too. I also would say assume nothing and anticipate the unexpected. For example, don't go in expecting everyone to be on board with the intervention you've selected. You need to be prepared as an agency to possibly have to go back and do some additional readiness work with targeted stakeholder groups or specific regions in order to truly be ready to move forward and achieve success. Throughout the readiness assessment, be prepared to listen and do not feel compelled to resolve issues that may arise at that precise moment. You can put those on a pen, on a bulletin note, and maybe address those later at some other time. In other words, take the necessary steps to fully explore the issues in your partnerships and with your stakeholders in a way that's both inclusive and responsive. I would also say when designing surveys or conducting focus groups, be intentional. Design surveys to be disseminated throughout your entire agency, collecting data and opinions of a variety of staff at all levels, all regions and counties, and including community providers. Be thoughtful up front in the design of the survey and focus group questions in terms of how you want to aggregate that information so that an analysis can be done to understand the feedback you've received. And I would also add, don't underestimate the importance of sharing the results and feedback from stakeholders who participate in this process. I think that's a step we sometimes skip, and I believe it's important for stakeholders who really took the time to respond to a survey or to participate in a focus group. They really want to hear the results of the survey and really hear about the results, as will the larger internal agency and external stakeholder community. I think that's a really important step we sometimes miss. Mona, any other thoughts?
No, I think you covered that. I think that's great.
Great. So Mona, I'm going to pose a question to you. What recommendations can you give the audience on deciding to adapt an existing tool or create a new one to assess readiness?
Thanks, Julie. We've mentioned probably several kind of tips already, but I would say be intentional about learning from prior implementation efforts. We've all tried to implement something in states, and sometimes that some things have worked well, some things not so well, and really, be intentional about taking those lessons learned and really thinking about what didn't go well or what did go well and determining whether they would fit here. I think the consideration of the even what other states have learned too. There may be some opportunity for some peer-to-peer if other states have had some successful implementation or maybe not so successful implementation of something similar that you're trying to implement. I think the other thing is, the other really key point I would mention is to do your homework, due diligence and exploring other existing readiness tools versus rushing to just develop a brand new tool or rushing to develop your own. We have a lot of tools that actually will be a part of our resources today, but there's a lot of tools out there that have been used and been really effective for assessing readiness. And just taking those tools and looking at them, see if there's one that fits for what you're implementing, and then don't be afraid to adapt it. I mean, if something doesn't fit or there's something that needs to be changed, whether it's the terminology that's used in your system or whatever, I think it's okay to build on the work of others and to adapt those tools so that it's very specific to your own needs or your agency efforts. And again, I just think, just being, again, I know we've used this word, but being intentional and deliberate about that and not just rushing to, well, let's develop our questions, let's develop our readiness tools so we can move it forward. Really take the time to think about how you want to approach that. I don't know, Joan or Julie, there may be other tips out there or something we may want to reiterate, but that's what I have.
No, I think you covered it really well, Mona. Thanks.
I agree. Great job.
Thanks, Mona. Yeah, definitely. Thank you, Julie and Mona and Joan. That was great. It's always great to hear from our experts about how this stuff actually applies in the field. So we're going to move on and get through some rest of our presentation, and we'll hear from these lovely ladies one more time today, and then they will be guiding your breakout sessions a little bit later. But we want to talk a little bit about planning your analysis approach. So teams really need to develop a plan for how they want to analyze the assessment results. How are they going to share it? Who are they going to share it with? As Julie was talking about, including that diverse pot of stakeholders with lots of different perspectives in the whole process, but even particularly the analysis process, can really help strengthen the team's understanding of readiness and the implications of the findings. If there's enough data, teams may want to look at the results by different groups or role, or if there is additional program, or by program area as well, to gain additional insights. When analyzing the whole section of results, it will help to assess overall organizational readiness as a comprehensive thing too. So next slide. We also want to have a plan for how to communicate this. As Julie was talking about, it's really, really important to make sure that those who participated, as well as the agency staff and stakeholders as a whole, they know about the assessment, they know what their role is in providing that really valuable information, and then also communicating the results. So having a strategy to recruit and engage participants, to clearly define their role and the value of the assessment to the organization, as well as following up and providing updates, thanking them and showing them how the information was used is really important. Assessing readiness is really less about a pass-fail mindset, as we've said, and more an activity that helps teams think about where they're strong or fully ready versus where they're maybe only partially ready. And most agencies, realistically, are not going to be strong or weak in all areas. Organizational readiness, as well as the intervention-specific readiness, will adapt over time, and so it's really important to continue to regularly assess using that same tool as a benchmark. This can also help to identify emerging trends or areas that the team may need to look at more closely as they continue through with implementation.
In the readiness continuum, agencies that are not ready can consider the following. What is the impact? And are there other strengths to support the gap? Agencies that are partially ready can ask, what is the impact? And is the gap a priority to fill? And agencies that are fully ready can ask, what data supports this? And how can these items support areas of need?
So there's often a rating framework with readiness items, and that's an opportunity to even generate further discussion and help the team determine how ready the agency is. So there's often a continuum from fully ready to go or partially ready or not ready or even don't know. So fully ready is really when the item is firmly in place or that a team strongly agrees with that statement. Partially ready are these in-between ratings. This would indicate that maybe the item is still under some phase of development or that maybe the team only agrees partially with the statement. Not ready is an item that there is not present or perhaps the team really disagrees with whether or not there are the supports in place for it. And sometimes it's just a don't know, and it might indicate that you need more information. They might have to go back and gather more information, as Mona was saying, with a survey or a focus group, or bring in some individuals either from the agency or partners that have some information specific to that item. So when we're analyzing our results, we want to identify and highlight the strengths. How can those strengths be leveraged to build support and a solid foundation for the change? Can strong leadership guide, or can strong champions help create that buy-in? We also want to identify areas for further development and take time to prioritize what has to be done before implementation begins and what items might be more long-term efforts to develop readiness over time. Are there additional resources, engagement, or partnerships that need to be brought in before moving to implementation? Are there gaps in knowledge and skills that could be addressed through training or hiring or even some ongoing coaching? Identify those key challenges or barriers. These are the things that are likely to impact the ability to effectively move forward to implementation. So are there relationship barriers that might impact the ability to have those community partnerships? Are there policy or legislative issues that might inhibit the ability to implement the program or practices that are needed? Any of these barriers, are they things that can be addressed, or does the implementation plan really need to be adapted to accommodate them so that the agency can continue to move forward? And then lastly, to use those results to really build a shared understanding of where the agency sits in readiness. So how can the team share and communicate that information to all of the stakeholders and really gain a shared understanding of what has to be done before you can move forward with implementation? So next steps. So we can use these assessment findings to determine what those next steps may be. And those decisions may be based on a number of different conditions or connections to the purpose of the readiness assessment. So it may have been part of an ongoing CQI process, and the data might need to be tracked and measured against some previous assessments. Have you made any improvements, or are there areas that are moving in the wrong direction that need to be addressed? Are there a lot of items that are marked as don't know? Maybe, as Mona was mentioning, that we need to do some focus groups or some focused assessments to determine if there's a level of readiness that you can get to. Is that the time available is often critical in deciding next steps. Teams may not always have the time to add this additional time for data collection, and sometimes they have to address some of those gaps revealed even without the time. They might have to actually adapt the intervention or change the overall initiative approach to really meet them where they're at in readiness. If they feel like they're confident in their readiness for a particular intervention, it might be ready to go ahead and move forward with implementation planning and capacity building. But it's always important to remember to come back because readiness and capacity evolve over time, and it really shouldn't be a one-time occurrence that we do this. As part of our implementation monitoring, teams should really be assessing their readiness and capacity at lots of different points in the implementation process, especially for those multi-year change initiatives. When we track those factors over time, we can update teams on their progress and also identify emerging needs or the barriers that might affect our ongoing implementation, or even the ability to transfer a pilot program to a statewide intervention. So we're going to have one last session from our panelists. So I'm going to turn it over to Julie to discuss a little bit more.
Thanks, Nicole. Great information you've provided. So I want to ask our panel members, starting with Joan, what recommendations would you give to participants who are really struggling with prioritizing gaps in their readiness assessment?
Yeah, and I think it's really important walking into this that you just kind of have to anticipate that you could have a lot of issues that are coming up that are going to have to be addressed. I mean, a lot of gaps. Even for an agency that's functioning on full throttle, there's just going to be a lot of things that can come up, and you have to be prepared for that. And I think it's easy to feel overwhelmed for, like maybe you're too far behind and there's no way we can do this. But it's important, I think, to stop and just maybe take a breath and not be overwhelmed by it. Because when you fill out any of these instruments that we're kind of talking about, you'll have the opportunity to maybe, look through when you look through the brief and some of the resources that are in there. If you fill out an instrument and you do all the due diligence, and there's maybe 30 questions or so, and a third of them come back saying that you've got some kind of a gap, that can be really overwhelming. But I'm an optimist. We're all social workers, I think, on the phone here today, and there's always a path forward. So I think my advice, I guess, in my experience with states is just to maybe start, there's no downside to really looking at the low-hanging fruit first. Maybe some identified gaps that are more easily or quickly resolved. This is really good for kind of keeping momentum going. You can realize some quick wins, and people can kind of see the progress is being made, and you could actually, shorten the list of kind of issues that are left to be addressed. And again, that can kind of keep momentum going. So I think that's maybe one strategy to keep in mind. In terms of looking at the harder, the larger readiness gaps, the tougher stuff, maybe to try to look at it from the lens of what is absolutely considered mission critical in terms of achieving the long-term success of whatever your change effort is. And so, again, stepping back, taking the time to thoughtfully kind of have the conversation with, with the team about, and with leadership, about what we absolutely have to get done, and then trying to, face your fears around addressing that and maybe triage some of those issues so that you're kind of dividing some of the work that needs to be done in terms of, you can categorize it by kind of short-term, midterm, long-term kind of issues to be addressed, or you can categorize it by, easy or hard or really hard, but just kind of trying to organize it that way. And then I think it's easier when you break it down and categorize it that way, in my experience anyway, to try to start figuring out how to address the gaps and trying to pick some of those issues off and try to make some progress on them. I think being able to articulate to everybody on the team, making sure everybody's on the same page about how long it's going to take to address some of these gaps, so everybody's realistic about, timelines and around the progress that's going to be made, and addressing all those gaps is important too. And being intentional about how to realistically address any of these gaps. And this has to do with just having a plan, and then, quite frankly, working your plan. And we all know about that. That's what we do all the time. But just keeping in mind that readiness, it's not a one-time event, and it's going to really change over time. But I just think the key things for me, and I'll ask Julie and Mona to weigh in here, are just to really kind of try to keep things moving momentum-wise and keep people engaged. Don't allow it to be something where it becomes kind of a side project for a person or two to be responsible for them. But you have a team, you pull it together, you have a plan, and you've got to work the plan and try to work on these recommendations and areas, that are identified as gaps, and try to work through it. I don't know, Julie or Mona, if you have anything you want to add.
Yeah, Joan, I really like your comment about facing your fears around addressing the harder stuff. And I would also maybe add to that too, really looking at capacity to be able to do that as well. That's just one thought I had.
Thank you, Joan and Julie. A couple more slides. We just wanted to talk, and we've talked about a lot of these already, but just as a reminder and a roll-up for folks, some of the more common missteps around assessing readiness. Again, not taking that time for regular comprehensive assessments. Sometimes moving so quickly from initiative to initiative in order to meet milestones without really fully assessing readiness for them. It can lead us to what we kind of term as initiative fatigue when our outcomes are not realized. Not including all the stakeholders who need to be on the team or providing a clear vision or communicating the next steps of an initiative. And then not getting sustained leadership engagement to help improve our decision-making processes and increase the capacity to efficiently get access to the resources that we need for implementation. So some quick strategies to prevent those common mistakes are to go slow to go fast. Taking time to be deliberate, as we've said many times today about assessing readiness, helps to ensure that those supports are in place. Having an ongoing comprehensive organizational readiness assessment to identify whether there is intervention-specific readiness before selecting the intervention. A clear communication about that alignment of the intervention with all of the other initiatives that the organization might be working on, like our strategic planning or federal reporting requirements. And then offering the support to engage those stakeholders to have sustained and meaningful engagement in the process, as Julie and Joan and Mona were discussing, being intentional. And then ensuring that the leadership for the effort is committed, intentional, and sustained, and that they have appropriate decision-making authority to help the team. So I'm going to turn it over to Chris King, who is with our program support team.
We are at the end of our scheduled time, so we will be finishing this webinar shortly. Feel free to contact us using our website, capacity.childwelfare.gov/states. That's capacity.childwelfare.gov/states. You can also contact us by our email address, capacityinfo@icf.com. That's capacityin@icf.com. Or by our phone number, 844-222-0272. Thank you for joining us, and have a great day.